Hello, this is Dr. Kavian Milani for Virginia Medical Updates. Today I want to talk about obesity. Obviously everyone knows that obesity is a major American or maybe kind of the Northern American issue in terms of the cause of diabetes, hypertension, cardiovascular disease, heart attacks, and general depression, fatigue, insomnia, sleep apnea, and a lot of other problems. The goal for this short presentation today is to talk about depression in the setting of obesity. Obesity basically is a major medical problem, and it is basically a balance of calories issue. So people normally consume calories, and people also burn calories. The resultant excess in calories that are intaken by the body compared to minus what is taken out through exercise or natural burning through the metabolic rate causes a caloric surplus and excess in calories, and this over months and years begins to build up, and it causes the phenomenon of obesity. Clearly, obesity is going to be difficult to control for the next few years. And the reason is that when we look at the children, the adolescents that are growing up now, the number of children that are obese is definitely on the rise. And a number of studies now have suggested and have actually documented that the medical interventions to help obesity in children is not very effective. So clearly this is going to be on the rise in the decades to come. For the adult population, this excess in calories needs to be balanced out in two particular ways. One way is going to be the use of healthier foods. Foods that are not processed, that are not coming out of the box, that are not microwavable things that we just buy, that are processed in a factory and is part of the food industry's packaging. Stuff that grows out of the earth that people can grow themselves or to buy and are basically natural are really much better food sources. And I believe that one issue is that everyone needs to take time out of the busy Fairfax, the busy Virginia, the busy Washington, D.C. lifestyle and increase physical activity. Something as simple as half an hour of fast walking 3 times a week, 4 times a week can be really beneficial. I also really want to emphasize that potentially the use of technology, like use of iPhones and smart devices like Garmin watches, for example, or Fitbit, and etc., are really beneficial potentially for keeping track of calories, even though there are some studies that show that there is potentially no benefit. But I believe that most of these studies have not been organized in a good way. Clearly, if people can keep track of what they're consuming and what they are actually burning, they could be much better in terms of their caloric consumption of food. So I do want to emphasize healthier eating, increased exercise, better sleep, stress management, and when it's all said and done, basically a better lifestyle. Thank you. This is Dr. Kavian Milani for Virginia Medical Updates.